cost of hepatitis C treatment remains the leading limitation to access to drugs today. The issue is not so much whether we can cure hepatitis C in 2015 and beyond, but whether we can afford to treat all patients now. No payer can afford to treat everyone all at one time because of the high cost of current regimens, but whether there can be an ethical, medically justifiable way of stratifying those individuals who are high priority, who require treatment at this time, and those who can safely and appropriately be deferred for the future. And I think this is something that is a point of contention because every patient in my clinic today wishes to be treated. There are two major barriers, one of which is the high costs that are charged by manufacturers, and number two are the very restrictive policies set by insurance companies that are, in many cases, restricting access to only those with stage 3 and 4 fibrosis, which is cirrhosis.
DAAs are expensive, but all of the studies to date have shown that they are cost-effective. Therapy may be somewhere between $50,000 and $100,000 for 12 weeks of therapy, but that's an upfront cost. What are we saving long-term? Well, we know we're curing the disease. We know that we'll be preventing the development of cirrhosis. In those who have cirrhosis, we're preventing the need for transplantation and the development of liver cancer. And we're having an improved 5-year all-cause mortality.
In reality, I don't believe cost is as much issue as we're making it out to be. The issue is the many patients who need treated and the budgets to afford that. One of the most ridiculous things that's going on is only treating those patients with advanced disease. And so what we're allowing is the patients with less advanced disease to go on and develop advanced disease later, and the cost that we have to deal with treating those patients, their comorbidities are going to be high.
I think one has to acknowledge that this is a major breakthrough, and this breakthrough is actually a breakthrough in cost containment, although it doesn't appear that way at the present time. Clearly, the cost per cure of these patients is markedly reduced.
We are beginning to see some of the impacts of the discounting of hepatitis C drug prices. Nobody pays $94,500 for Langone or the $84,000 or so for the Vicara pack products. There are some examples of exclusivity agreements. For example, Express Scripts has made a deal to provide Vicara pack essentially for all patients with hepatitis C who meet medical eligibility without restriction based on stage of liver fibrosis. That is a unique arrangement that I think is overall a win for patients, but I think as a clinician, we don't want restriction of access to any drug.
We are having difficulty getting early stage patients treated for two reasons. One, in the United States, we have Medicaid. So for instance, in Texas, in the last few years, we have not been able to treat patients. Now, with the new government initiatives, we're going to have treatment of just patients with more advanced disease. The cost has been reduced through negotiations and competition about 46%. So if you look at it, even with $1,000 per pill, the cost per cure was adequate.
Well, in the short run, people are going to have to lay out additional sums for the medication. But they're going to be saving tremendous amounts of money because the medications don't have any side effects and overall are being administered for relatively short periods of time compared to the previous medications. And in addition, in the longer run, as they are going to avoid liver transplants and the prolonged hospitalizations of people with decompensated hepatitis C cirrhosis, the country, Medicaid, Medicare, and the insurance company are going to save a lot of money.
If we treat all of the people with hepatitis C this year, there isn't going to be enough money in anyone's healthcare budget for anything else. But that's not reality. Economists, healthcare executives are looking at what the potential cost could be and then saying we're going to have to pay for it all this year, but we're not.